Hi, my name is Ruth, and today I'm going to talk to you about birth control. I have my friend Margaret here with me to help teach you about this particular topic. Let's get started. The term birth control, also known as contraception, is any method, medicine, or device used to prevent pregnancy. So, Ruth, what are the different types of options available for use? Great question, Margaret. When looking at birth control options, one has many to choose from. These include implants, IUDs, variations of an oral pill, shots, condoms, diaphragms, and even, possibly, tubal ligation. How does one obtain birth control? Do you have to go to the doctor to get it? Not all types of birth control require prescriptions. These include male and female condoms, sponges, spermicides, and emergency contraceptive pills. However, some do require a prescription. These include IUDs, implants, shots, pills, patches, or rings. So, Ruth, what exactly can birth control do for me? Well, Margaret, contraception can help manage pregnancies and birth by allowing one to choose whether or not they want to become pregnant. If one does desire to become pregnant, birth control allows autonomy to choose the timing, member, and spacing of births. This reduces the likelihood of premature births and low birth weight. Contraceptives can prevent pre-existing health conditions from worsening or new health problems from arising that may result from an unintended pregnancy. Contraception can also help its users meet their educational, financial, and personal goals. Economic analyses have found positive correlations between the availability of contraceptives and education, labor force participation, average earnings, and reduction in the gender wage gap. Does birth control have any other medical uses other than preventing pregnancy? Yes. Contraceptives can be prescribed for a wide variety of health reasons. The National Coalition for Sexual Health states that birth control has many non-contraceptive uses, such as helping with irregular periods and stabilizing negative symptoms such as heavy bleeding or cramping. It also has the ability to stop your periods. There are many reasons someone might want to stop their period. Transgender men who are assigned female at birth and identify as men may not wish to have their periods. Cisgender women may want to avoid their cycles because of significant PMS symptoms or menstrual migraines. It can also help decrease acne. Hormones are one of the leading causes of breakouts, and the birth control pill is great for helping with hormonal acne because, according to the American Academy of Dermatology, androgens, which are male sex hormones, can cause acne. Birth control pills target androgens and lower the levels of them in the body. It can also help treat serious medical conditions such as PMS and PMDD. These are mood disorders that are caused by hormonal fluctuations leading up to your periods. When taking the birth control pill, there is an option to skip those symptoms by manipulating the length of their period placebo, which leads to fewer PMS symptoms. So, Ruth, how does one pay for birth control, and how much does it cost? The cost of birth control varies depending on whether or not you have health insurance or possibly qualify for Medicaid and other government programs that may cover their cost. In 2010, the Affordable Care Act was passed, and under a provision of this federal statute, it became federal law that most private insurance plans must cover all methods of birth control at no personal cost.